So in 1943, Kanner described it, and a little bit later on, Asperger's described it. Asperger's was German, and Kanner was American, at least working out of America. So they contained these detailed cases of what autism is, and these really have informed us ever since, and we can characterize the symptoms of autism via these very early descriptions. Now, both of these authorities believed that there was present from birth a fundamental disturbance which gave rise to highly characteristic problems, and in their clinics they identified these children, and so they saw different cases of what would be, strange children, or children that just were different, but different in a very particular way. And this is what's come to form the triad of impairments now. And we've come to what is a somewhat more humane description of autism than existed in the past. It's been known by a variety of different names there. We won't go through them now. But these children seemed unable to entertain normal, effective relationships with and this had a gross impairment on their lifespan, if you like, later influence and relationships with other people, as well as communication and these stereotypical behaviours. I'm just going to skip these pages because we're running out of time here, and come on to something perhaps a little bit more pertinent about assessment and diagnosis. I want to introduce you to perhaps how today we characterise autism. So there's the ICD-10, which is the International Classification of Disorders, again volume 10, and the DSM, the Diagnostic Statistical and Manual of Mental Disorders version 4, and this is the checklist or the tick list medical model approach. If you have enough symptoms, you'll get a diagnosis. Okay, there are multiple referral routes, so from school, from clinics, from family, and at least in the UK there's a lot of pressure on local authorities to restrict resources to parents and the educational system. And often it's the case that parents have to fight for their right, or the rights of their child to be even assessed, let alone diagnosed. And really, these days, a child who certainly is on the borderline of an autistic diagnosis can have a lot of problems getting the appropriate treatment there. So there's a lot of pressure on government funds, at least in the UK, not to diagnose. Okay. As I've said, there's a lot of pressure on people not to diagnose, but how is diagnosis conducted? Well, there are various government organisations, both in America and in the UK, that set forth criteria that a child has to attain before they get a diagnosis, or even are referred for assessment, which is often conducted by an educational psychologist, a psychiatrist, a clinical psychologist, or a medical doctor, or paediatrician, child paediatrician. Basically, what we're dealing with is a cross between the medical field and the psychiatry field and the field of psychology. Okay, so diagnosed by a professional. When that diagnosis comes, based on various criteria, some of which I've put up here, the special needs system will kick in and provision will be made within the educational system. So, these are just some markers here. Does the child, and we're talking about childhood autism here at this stage, because it's interesting to see how children are first diagnosed, does not babble or coo by 12 months, does not gesture or point or wave or grasp by a year-old, does not say single words by 16 months, does not say these two-word phrases which are critical to language development because it means they're having a representational language structure there. So, I want, or bad tummy, give me, for instance. These are the very foundations of language itself, representing thoughts linguistically. And a child that has any less, a loss of language there or social skill at any age, really. So we're seeing a difference in children very early on, but when compared to traditional development. Often in families, you'll get one child with Asperger's or often autism, and another child or children without autism. And the differences are profound, and there are obvious developmental differences in language, in communication, in the way they hold themselves, in their interest. And these markers are as individual as personalities are. So the expression of development through the lifespan is atypical, but characteristic of autistic traits in very, very young children. Okay, so assessment for the purpose of diagnosis typically occurs in clinics or private medical practices and is led by, as I said before, psychiatrists, psychologists and physicians there. I'm not going to go into any detail, but these are various rating systems here, except to say that they're done behaviourally. So they're done on observing a child rather than taking a blood test, rather than having a DNA test, anything like that. So they have a measure of objectivity in them. Okay, so bear in mind that these are as much based on the observations and experience of clinicians as they are on the checklists themselves. So observations lead to marking the criteria that lead to a diagnosis. And there are often screeners that test for autism at a very young age. But essentially what they are observational schedules, or lists of symptoms that a clinician or professional will tick. So have you had this across domains? Have you had it in school, at home, with your friends? Have you had this before the age of whatever it might be? Does this markedly impair on functioning? Does it get in the way of everyday life, that means? And are the symptoms explained by another condition? So is there a medical condition that would explain it? When I have flu, for instance, I'm not a very nice person to get on with. I don't often talk. I often rub my nose a lot. So I can seem to be having social impairment, poor verbal communication, and I'm stimming or having this repetitive movements towards my nose. Essentially, they're autistic traits. But because I can better explain it by having the flu or having a cold, that clearly isn't autism. So if we can explain away a condition by another means, then it's clearly not autism. So this is a way we differentially diagnose autism there. So is it better explained by something else that just common sense tells us that's it? Very important to use common sense when dealing with psychiatric diagnosis there. Okay, well, it's clearly easier to spot autism at the low functioning